I'm Molly Sue. Today we are going to go over the various structures of the eye and their functions. Our eye is one of the most complex systems in the entire body. It is constantly focusing and accommodating so that we are able to experience the world around us through light, shapes, colors, and definitions. We are going to start with the part of the eye that most people are familiar with, the sclera. The sclera is the tough, protective part of the eye that is most commonly referred to as the white of your eye that you can see here around the eye. Its function is to help maintain the shape of the eye as well as protect the eyeball. The conjunctiva is a clear layer of tissue that sits on top of the eye. Its function is to also protect the eye. It actually loops all the way underneath the eyeball, so to anyone who has ever feared losing their contact in their eye, the conjunctiva is the reason why this does not happen. The eye has two chambers, the anterior chamber, found here, and the posterior chamber, found here. We are going to start first in the anterior chamber and explore its system and functions. The cornea is this right here. It's the clear outer part of your eye. It protects the entire eye and allows the light to pass through it. It is the strongest refractive part of the eye. The anterior chamber is between the cornea and the iris, and it is filled with aqueous humor. Aqueous humor is produced in the ciliary bodies, found here, and it flows around the lens to give it nourishment. It then flows through the pupil and is removed through the canal schlemm. The canal schlemm is located in the angle between the cornea and the lens. The canal schlemm drains the aqueous humor through a tiny drain called the trabecular meshwork. The iris is the colored, pigmented part of the eye. It gives your eye its color, which also gives you your look. It controls the amount of light let in through the pupil. The iris will either dilate or constrict the pupil, allowing more or less light in. Think of it almost like a shutter on a camera. The pupil is the round hole found in the middle of the iris. It allows light to pass through to the lens, and contrary to what most people believe, it is actually a hole and appears dark because there is little light coming from behind it. The ciliary body is attached to the iris, found here. It contracts or relaxes the lens via zonules that wrap around the lens. This allows the lens to thicken or thin out so that the lens can focus on near or far away objects. The ciliary body also produces aqueous humor. Behind the iris is the lens. The lens is clear and flexible and is responsible for near focusing and accommodating. It is responsible for focusing the light on the retina to form an image. Behind the lens is the posterior chamber, found here. It is filled with vitreous humor. Vitreous humor is a clear, gel-like substance that gives the eye its shape. The ora serrata marks the boundary between the retina and the ciliary body. The area where the retina ends and the ciliary body begins is where the ora serrata can be found. The ora serrata receives its name due to its serrated edge that can be seen here. In the back of the eye, we have the retina. The retina is the innermost part of your eye and is the most delicate. The retina is a light-sensitive layer of tissue. It acts like the film in a camera. Images come through the cornea to the lens and are focused then on the retina. The retina then converts these images to electrical signals and sends them via the optic nerve to the brain. The retina contains photoreceptors that are made up of rods and cones. Rods are more sensitive to light, and cones are more sensitive to color. This area in the back of the retina is called the macula. The macula is the main part of your vision, and inside the macula is the fovea centralis, which is the most acute part of your vision. It contains the highest number of cones. This layer here, behind the retina, is called the choroid. It contains blood vessels and carries the blood supply for the eye. And right behind it is the sclera, which is the area that we started with earlier, which is the white, tough, protective part of the eye. This bundle here is called the optic nerve. It is a bundle of neuron fibers that carries all the information that the retina processes to the occipital cortex of the brain. This spot in front of the optic nerve is known as the optic disc. This is the area on the retina where the optic nerve is leaving the eye, which creates a blind spot in each eye. Now I am going to discuss a few diseases that are associated with parts of the eye. We will be discussing glaucoma, cataracts, and keratoconus. We will first start with glaucoma. A healthy eye is circulated with aqueous humor, which we discussed earlier, that is found in the anterior chamber of the eye between the cornea and the iris. It is produced in the ciliary body and it nourishes the lens. It flows out through the canal of Schlemm through a microscopic drain called the trabecular meshwork. Glaucoma occurs when the drainage angle of the eye becomes blocked. The lack of drainage will cause internal pressure inside the eye that will affect the optic nerve, where it could cause blindness. There are two types of glaucoma: open-angle glaucoma and closed-angle glaucoma. Open-angle glaucoma is referred to as sneaky because it does not show any symptoms until there is loss of vision. By the time people are aware of the loss of vision, the glaucoma is usually advanced. Sadly, vision loss due to glaucoma is irreversible. Glaucoma can be inherited and may not show up until later in life. People of Asian descent and people who are nearsighted are more at risk for closed-angle glaucoma. Symptoms of closed-angle glaucoma are blurry vision, the appearance of rainbow-colored circles around bright lights, sudden loss of vision, severe eye and head pain, and nausea or vomiting due to the severe eye or head pain. It is necessary to catch glaucoma in its earliest stages so that loss of vision can be prevented. Glaucoma can be treated through drops, pills, laser surgery, or even through traditional surgery. Pills and drops work to lessen the production of aqueous fluid. They should be taken daily. Through surgery, a laser is used to change the drainage system of the eye so that the aqueous fluid is able to pass through the canal of Schlemm more easily and drain out. This surgery is very common and has a good outcome of lowering the internal pressure in the eye. The good news is, if glaucoma is caught early on and treated, most people will not lose their sight. Up next, we will discuss cataracts. Another disease that can be found in the eye is a cataract. A cataract affects the lens. It forms when there is a buildup of protein on the lens, which causes the lens to become cloudy. The cloudy lens prevents light from passing through the lens, which can result in the loss of vision. The occurrence of a cataract could be age-related. a congenital defect be caused due to an injury or even due to another type of medical condition. However, it is most common to develop a cataract as you age. There are several symptoms that indicate a cataract has formed in the eye. You may experience blurry, cloudy, or even foggy vision if you have a cataract. Other symptoms may include difficulty driving at night due to glares of oncoming traffic, changes in the way you see color because of the lens that acts as a filter is discolored, double vision, problems with glares during the day, sudden changes in contact or glasses prescription, and an increase in nearsightedness. If a cataract patient's vision cannot be improved through the use of glasses, they may be a candidate for cataract surgery. During surgery, the lens affected with a cataract is removed and is replaced with an artificial lens. Lastly, we will discuss keratoconus. Keratoconus is a disease that affects the cornea, found here in the front of the eye. A healthy cornea has a dome-like shape that you can see on the model here, and it is held in place by tiny fibers of protein. When these fibers become weak, the cornea cannot hold its round shape, so it starts to bulge forward, forming a more cone-like shape. Symptoms of keratoconus can be ghosting, glares, halos, starburst of light, blurred vision, and multiple images. Keratoconus is hereditary. If a parent has this disease, it is most likely that children will also develop it too. It usually starts to show up in teenage years, but can start to develop in early childhood sometimes, as well as even develop later in life. Keratoconus conditions seem to happen more often to people affected with allergies. It is possible that the condition is even related to consistent eye rubbing. Most times, keratoconus usually develops in both eyes. The cornea can change shape quickly, or the change can occur over several years. The changes that occur to the cornea from keratoconus make it impossible for the eye to focus on its own. Contacts and glasses can be worn, and in some cases, a cornea transplant may be needed to restore vision that has been lost. Thank you for tuning in and listening to my video. The eye is a very complex system, but it allows us to experience our world around us through color, light, shapes, and definitions. It is very important.